Hello, my name is Daley, Professor of Special Care Dentistry and Dean of Dental Affairs at the Dublin Dental University Hospital. This year, Dublin is hosting the 50th Annual General Conference of ADEE, and our theme is Reflect, Recognise and Reimagine. As one of the local organisers, it was very important to me that in this reflection and reimagination that we would remember first oral health inequalities, and that the whole reason that we train the dental workforce is to ensure that there are better oral health outcomes. And the other aspect that was very important to me was to make sure not to leave anyone behind, and in particular those living with disabilities, marginalised groups and underserved populations. 11 to 15% of the population live with disabilities. So it's really important that the future dental workforce have the skills and competence to meet the dental needs of people with disabilities. They're going to be part of your everyday working life. So it's critically important that our future dental workforce have the skill set to meet the needs of this population. The presenters we have, excellent presenters from very different settings, from very different countries, will be able to show us how to reimagine how we can train the dental workforce to meet the needs of people with disabilities in the future.
My name is Alison Dougal and I work here at Trinity College in Dublin. So I was delighted when ADEE asked me, as part of the 50th anniversary, to organise a seminar looking at education in special care dentistry. About 15 years ago, I led a task force made up of ADEE members and members of the International Association for Disability and Oral Health. Our aim was to design a curriculum which would give students the competencies, behaviours, profiles to be able to treat a very, very much more diverse population. So we're here to actually have a look how we've been getting on. We've got some of the early adopters of the curriculum to see how they've navigated the road bumps of implementing disability into the student case mix. We've got the opportunity to pool our experience. We know that one of the big problems has been somebody to teach disability and special care dentistry within the curriculum. We know that there are many competing hours for people to put their subject into curriculum. So hopefully we can show how including people with disabilities can tick many boxes of interdisciplinary care, person-centred learning, behavioural support, prevention, and how we can teach students to adapt their approaches to a much more diverse population.
Hello. I'm Jacobo Limeres Pose from the Santiago de Compostela University in the northwest of Spain. I'm going to talk about the disability and dentistry, and specifically how to expose the students, undergraduate students, to the clinical training. We think that theoretical lessons are important, but regarding disability, to expose the students to the contact with the patient and with real stories is fundamental to get the knowledge, the skills and the attitudes that they need as graduate dentists to deal with patients with disability.
My name is Denise Folks. I'm a special care specialist working in Clermont-Ferrand in France, where we have a special care curriculum for the undergraduates over the last 25 years. My talk today is going to be about a set of qualitative studies we undertook, looking at students who had had very limited clinical exposure to special care dentistry, which shows that those students discover special care, they discover the patients, it demystifies the discipline, but it's obviously completely inadequate to create competency when leaving dental school. And then we have a second set of students who have done an optional module, and I have now 20 years worth of students that have gone through that module, which was 1 day a week in the special care unit over 2 years. And we can show now with that qualitative study that these students come out of dental school competent, willing, with the right attitudes, and that they do actually put that into their primary care practice when they leave. So special care dentistry is something that we can teach to undergraduates and that we can create competent primary care practitioners when they leave school.
As somebody who has gone through the dental education system without education in special care dentistry, I feel privileged to have the opportunity to be able to bring to ADEE the skills and techniques that I've learned over the years so that future dentists can leave dentistry with the skills to serve the whole population. I've taken time over the years to specialise in special care dentistry, and my specialism can be brought to our undergraduates using the IADH curriculum in special care dentistry. This curriculum allows us to map our practice to standards that have been set out by the best in the world. Every year, we apply the IADH curriculum for our students so as they can grow not only as dentists, but as people, so as that we can produce a workforce that can not only have the technical skills, but also the perspective, the attitudes, and a sense of responsibility that we hope our current and future healthcare services can provide to patients of all abilities.
My name is Jörg Vogel. I'm the Global Vice President for Institutional Business in Dentsply Sirona. I take care of all the institutional academic customers, military, Ministry of Health. We work a lot with the United Nations and with the WHO projects, and I run this as a Global Vice President. It's very close to my heart. And I think in every family, in every group, you have people with disabilities, you know somebody. And I think the industry is so far not really supporting this. And I think Dentsply Sirona is the world's largest dental company. We also have a social responsibility. So I really think we need to support this initiative. And when talking to the people of the World Health Organization, we've learned that there's about 1.7 billion people with disabilities. That's a growing group, and we really need to focus on these people.